Hello, lovely. How are you? Good. I'm Doctor Nicola, and I'll be taking care of you today. So, my love, I have your notes from the emergency room, and I believe that you've came in on an ambulance today. And you haven't been too well, is that right? Okay. Well, you are in the Acute Stroke Unit today, also known as the TIA clinic. And do you know why you've been brought here? Yeah, that's right. So they've suspected that you've had a mini stroke. Yeah, that's right. I know it's a little bit alarming, but rest assured, I am here to carry out a full assessment on you and find out what's been happening. You're in safe hands, I assure you. Okay, so before we start, I will have to get you to confirm your name. Thank you. And your date of birth. Who is your general practitioner? Excellent. And can I take a contact number from you? Wonderful. So they've done the pressure. Okay. Yep. Right. That's fine. Okay. Right, so people do have strokes, or they have many strokes, and the good thing is they are only suspecting a mini stroke with you, and I would say so by looking at you, which is a positive. However, you are at risk for a full stroke within the next few days to weeks. Alright, I know that's a little bit scary, but I'm going to be here just to check and see if everything is working as it should be. Alright, so I am one of the specialist TIA practitioners, and I'm also a neurologist. Okay, so I know everything, don't worry about that. Okay, and I know what to look out for. But I must ask you, when did this happen? Can you remember roughly? Okay. Okay, that's good. And was it yourself that rang the ambulance, or? Okay. Are they with you? Good, that's fine. did these symptoms last for? Can you remember? Or were you told? Right, so a fair amount of time. And can you just tell me what the symptoms were? Yeah. Was that both sides? Okay. Yeah. Right. From what you've told me, you are experiencing typical stroke symptoms, but because they have subsided, I would say it was a TIA rather than a full stroke, which is a really good positive. However, they still come with their concerns. But I don't want you to worry, lovely. You're in the right place, and I'm going to carry out a thorough examination on you today so we can get to the bottom of what went on and make sure that you've got no lasting effects or any blood clots and things like that. Alright. I know it's a little bit daunting, but I assure you everything's going to be okay. So you didn't experience any paralysis, which is great. No vomiting. No loss of consciousness, which is great. Balance was a little bit strange and off. And the dizziness and the vertigo, that kind of makes sense. So you had blurred vision and spots and double vision, but no vision loss, which is good. Right. Slight confusion, again, which is understandable, and no issues swallowing, which is great. And you said that rested out. Yes, that's fine. Okay, slightly on the longer side, but you came in quickly. You were in the emergency room for about 3 hours under observation, whilst the team were waiting for me. I do apologise, I have been extremely busy. But the good thing is, everything subsided while you were in there, which is great. And you were given aspirin, which is a good starting point. Saves me doing that, which is a must as soon as we get any patients coming with suspected TIA, we must give them aspirin immediately. Yes, I'm glad that's been done. That's brilliant. So, have you got any history of strokes or TIAs or heart problems in your family? What about history of blood clots for yourself or family members? Okay, that's good. If I could get you to pop your index finger in here, I'm going to check your pulse. You can keep nice and still for me. On the high side. going to do your blood pressure. I'll just like you to put your arm right there. Okay. Okay, if you just keep nice and still for me, okay, and make sure your legs aren't crossed. Thank you. Start going quite tight now. Right. It's still fairly high. Don't worry. So, I'm going to get my light, alright, and I'm going to have a look in those beautiful eyes of yours, alright. All I need you to do is just focus on the back wall for me. I'm just going to shine a light in your eyes and just see how your pupils are reacting to the light. Alright, good. Wonderful. Now here. 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 Perfect. Look at my nose. See that? Great, excellent. Can you just tell me how many fingers I'm holding up now? Yep. Good. Perfect. Excellent. All seem really clear. No issues. Great. I can get you to just look at my chart. Alright. If I could get you to read the first 3 lines for me. Good. What colour is this? And this? Good. If you could read the line above the green. Excellent. And the line above the red. Wonderful. That's fine. These words in here are very small. I want you to read me the word under the number. Alright, so I'm going to keep that about here. If you could read me the word under 1. And what about under 5? Under 8? And finally, number 10. Good. We have 1 and 2. I'm just going to pop this over. How do I look to you? Okay, and again. Which one's clearer? All right, and number 2. Which one's clearer? So, I'm going to pop that there. I'm going to have a little look in your eye. Good. Excellent. And this one. Perfect. No problems there at all, which is really good. Great. So, I'm going to get my gloves now. Right. If I could get you to stand up for me. If I could get you to go to the other side of the room for me and just stand against that wall and face that side of the room. Right, if I could get you to just walk normally, and I want you to go from there to the other side of the room. Are you ready? Wonderful. Great. Now if you could walk backwards for me. I know it'd be a little bit difficult, but you're perfectly safe. There's nothing in your way. That's good. You're doing well. Fantastic, thank you. You can come back. That's perfect. If I could get you to just stand on one leg, you can start this side for me. Hold it. Are you normally quite wobbly? You're doing well though. Okay, swap to the other side. Excellent. Okay, you can stop. That's fine. I take it you don't do yoga. It's fine. So did you experience any dizziness or anything when you were walking across and going backwards? Okay, that's brilliant. Please take a seat. I've got my hands here. I'm going to get you to grab them like so. Yep. I want you to push my hands forward. That's it, good. Now I'm going to push back and I want you to try and fight it. Perfect, don't worry, that's fine. Perfect, okay, you can stop. Now, if I could get you to put your hands that way, just squeeze as tight as you can for me. That's it, with both hands, good. Perfect. Now just with your left hand. Good. Nice grip. Now the other side. Wonderful grip there. That's good. Okay, relax. I'm going to pop my hands on your shoulders. If you could just shrug up and down for me. Wonderful. Okay, now just raise the shoulders and hold. Good. Now I'm going to push down. Try to resist. Good. Push up. Excellent. That's great. You can relax. Thank you. It's looking really well so far. All right. Feeling good? Perfect. So, I have these little things here, a Q-tip and a Japanese Woodstick. As you can see, this bit's nice and fluffy, and that's just your normal cotton bud end. And then this end you have a little bit of a scraper, so it's a little bit firmer. Alright, in a moment I'm going to get you to close your eyes, and I'm going to gently touch areas of your face. If you can just tell me if you can feel it first. Alright, so please close your eyes. Perfect. Fantastic. Good. Great. Now, if you could just tell me if it's Q-tip, fluffy, or hard. Okay. Yep. Great. Good. Great. Good. Yep. Wonderful. You can open your eyes. You could pop your palms out for me. And if you just look straight ahead, do you feel that? That. Other side. Perfect. If you can just lift your feet for me, like so. Keep looking straight ahead. Feel that? Good. Other side. Perfect. You can relax for me. And you could feel that all fine. Good. Close your eyes for me. You feel that? Good. That. Good. That. Great, you can open. Happy with that. Fantastic. So, where are you? There we are. Okay, I'm just going to blow a little bit of air on your face. You can just tell me if you can feel that. Excellent. And palm of your hands. Good. And your feet. You feel all that? Perfect. Right. If I could get you to touch your nose, then touch my finger. When you're ready. So your nose, finger. That's it. Just like that. Okay, and this side. Nose to finger. Okay. And a little bit closer. Try again. Nose to finger. Yep. And this one. Nose to finger. Brilliant. See that okay? Good. Okay, I'm going to pop these on. While I pop these on, if I could get you to literally just get yourself comfortable, relax, just chill. I know it's easier said than done. Alright, I'm going to have a good feel around your face, your ears and your scalp. I can't see any drooping, no, it looks good, but I want to check properly. Alright, yeah. Good. Right. If I could get you to smile nice and big for me. Good. Keep holding. Okay. Raise your brows. Hold. Okay. Scrunch your face for me and hold. Relax. Suck your cheeks in and hold. Good. Relax. Puff your cheeks out and hold. Good. Relax for me. If I could get you to turn your head that way and hold. Back that way. Good. Back. Head up. Head to your chest. Any pain or anything around the neck area? Brilliant. That's really good. Let's rotate your head for me in a full circle and then back the other way. Any pain, discomfort, tingling? Wonderful. Good. I'm just going to have a look now. See what the muscles feel like. Okay. That's good. That's wonderful. Perfect. Okay, I'm going to say something in your ear. If you can just repeat it. 1, 2, 3, 4, 5, 6, 10, 11, 12, 13, 14, 15. Can you hear me okay? Good. I'm going to pop these either side of your head next to your ears. I'm going to make a sound. If you can just say which side that you heard. Fantastic. You're doing really well. It's all good. Right. Everything is looking absolutely perfect. Okay, so I can't see any lasting damage. Yeah, everything is functioning properly. Alright, your eyes look really healthy. Pupils are retracting when they should. You can see things, your vision's okay. You can hear very clearly. I can't feel anything, you're not in pain, and there's no tingling or burning sensation. And your spine feels fine, and you've got no problems like that, no headache or anything. Alright, that's great. And you no longer have any symptoms. Your face is fine, symmetrical, no drooping or anything like that. You can carry out instructions fine, your balance is fine, your coordination is fine, everything is appearing extremely healthy. Yes, definitely. So I'm going to say you definitely had a TIA. Alright. And I need to carry out an ECG just to be sure. Okay, so I'm going to check your heart. That is a must. And I need to do a blood test. I need to check your levels and things, okay? I need to check your cholesterol, blood count, and a few other things that I need to check, okay? So I'm going to do that. And I'm going to wait and get the results back today, so I'm going to push them as an urgent through. Alright. I think I might send you for an ultrasound scan, okay, on your neck area. I'm looking for any blockages up to your brain. So basically, TIA, one of the blood vessels that supplies oxygen to your brain gets blocked, okay? And you can get blood clots in anywhere in your body. Alright, yeah. Have you noticed any swelling anywhere at all? Any bruises that have appeared in the last 6 hours or so? Okay, good. You need to make sure there's no blood clot. I don't think I'm going to carry out an MRI on your brain. I don't feel I need to. Alright. I feel it's important to check for blockages, the bloods, and obviously the ECG on your heart, just to make sure that's working as it should be and pumping around, especially with the high blood pressure and high pulse. I think it's important that I carry that out. All right. Yes, that's right. And that one, if you do have a blockage, it will be in the carotid artery. All right. And we may need to do surgery to unblock that. However, there is other treatments that we can do beforehand. Yeah, that's right. So when I do the ultrasound scan, that will see if that's blocked. Yeah. Okay. I need you to stay here, and I will need to get you a bed, and you will need to stay overnight at least. All right. I want to carry these other tests out first. I think it's extremely important. Yeah, I'll do the bloods first, okay? Then I will get you sent for an ECG, then for the ultrasound, okay? Depending on all those findings, then I may do an MRI. All right, it just depends on that. That's right. I will need you to keep an eye on your lifestyle. All right. Yeah, that's right. It's very important to keep healthy, keep active, and have a good diet, water intake. Okay. Yeah, that's fine. Good. certain medication that I may have to put you on to prevent blood clots. Okay, so Warfarin, and there's a few other ones that we could try you on, and we could possibly put you on an antiplatelet as well. So we could put you on clopidogrel, maybe, but it might give you indigestion and chance of bleeding, unfortunately. But then that's the same with the other. Yes, that's right. Unfortunately, there's always side effects and, yeah, things that could make things, you know, worse. Good. So that's that. No, I don't want to give you any more aspirin. That's fine. Don't worry. So, if your blood pressure doesn't go down, I'm going to have to prescribe you something for your blood pressure, such as beta blockers, okay? We could do calcium channel blockers. Also there, yeah, okay. If your cholesterol is level, we'll have to put you on some statins, okay, to reduce that, such as rosuvastatin. I don't want to give you surgery unless you really have to. I doubt it, but I have to let you know. Right, and obviously I will prescribe you medication before you go home. But let me do them bloods, and then I'm going to go and arrange these tests for you urgently. So, bloods. That's fine. Okay, let me just check your arm. Do you have a better arm? That feels quite good. I'm going to do that one. Excellent. Just do a little bit of pumping for me. Okay. Okay. Good. Let me just feel. It's good. It's ready. I love when we have an easy patient, you know. some you just can't get anything out of. Not easily, anyway. Okay. Feel a sharp scratch now. Good. All done. How's that for you? Not too bad. Just press down for me. Excellent. That's done that. Okay. Great. So that is our assessment complete. All right, so I'm very happy with things. Okay, so nothing to worry about. I have taken obviously your bloods. I'm going to get down to the lab and get those in as an urgent. Then I'm going to pop over to the ECG department and get that all set up for you. Then I'm going to go over to the ultrasound department and get that set up for you as well. All right, my lovely. Yeah, that's fine. That will be all done in the next few hours. All right, I am pushing that through and I need that sorting. It's very important that we get these checked. Then if I am concerned, I will carry out a MRI scan. So obviously the brain is very delicate, as you can see, and it has lots of blood vessels. After a stroke or a TIA, it can leave patches on your brain, which is sort of like brain damage. All right, not necessarily going to affect you, maybe in later life, but not necessarily. So it's always good sometimes to carry that out. I don't necessarily like doing that unless I feel it's necessary. So if I am concerned by your findings on the other tests, I will get you in for that brain scan. All right. Yeah. But you can see the brain go down to the spinal cord. It's quite complex and there's different areas that can actually develop damage. It depends where the clot was and where the damage is formed. Yeah. So once I've done those tests, I will know what's what, and then I can do more treatment accordingly. Yeah, that's fine. And obviously your eye is perfectly fine. I've got no issues with that. All right, my lovely. You are very, very welcome. All right. Now you take some time to just relax and I will go and get one of the nurses and then I will see you shortly. You take care now. Bye-bye.